Hi, my name is Dr. David Hume and I'm a consultant anaesthetist here at Blackpool Victoria Hospital, and I would like to welcome you to your surgery school. This short film is designed to improve your recovery after surgery. Surgery puts your body under a lot of stress, and our aim is to make sure that you have the best possible care before, during and after your operation. We want to help you be as fit as possible, so as to reduce your risk of complications, which may delay your recovery and ultimately lengthen your stay in hospital. Surgery school will help you and your family and friends prepare for your operation. We are doing this online, so you can access the information whenever you want, before your operation, whilst you're in hospital, and when you're recovering at home. It's really important to understand that you have a crucial role in your own recovery. Get yourself as fit as possible, stop smoking, eat healthily, and do some exercise before you come in for your hospital stay. You can be vulnerable to chest infections after surgery, so we'll teach you some chest training exercises designed to prevent this complication. This chest training should be commenced prior to your operation, and along with appropriate pain relief, you should continue this regime as soon as possible after your surgery. We'll provide you with information about healthy eating, so your body has enough energy to recover after your operation. Making the best use of the information we provide you with at surgery school will minimise the stress caused by your operation and ultimately improve your experience.
Hi, my name's Caroline and I'm one of the Enhanced Recovery nurses here at Blackpool. It is important that you and your family take an active role in your recovery, as you will find it easier having support around you, especially when you return home. It is therefore important you understand why we are asking you to participate in these activities. We have included slides for you and your family to read at your leisure to explain why participating in Enhanced Recovery After Surgery, or ERAS, is important. You will also be given an ERAS diary in your preoperative assessment, which contains information about the service and how ERAS principles can help with your recovery. We will use this diary each day to discuss your daily aims whilst in hospital, so please bring this along with you on your admission day. ERAS is used to improve your surgical recovery. At Blackpool Teaching Hospitals, we aim to provide high standards of care based on current recommendations and protocols. Our aim is to reduce your risk of having any surgical related complications and to ensure you have the best possible recovery. Having surgery is a stress to your body, which will therefore make you more at risk of developing complications. We know that by doing certain things we can massively reduce your risk of developing these complications and subsequently reduce your length of stay in hospital and get you back home safely. We want to provide you with the information about how and why chest problems can occur. We'll help you to combat the effects of a general anaesthetic and avoid a chest infection by doing the following. The risk of developing a chest infection is increased by bacteria living in your mouth. This can then travel to your chest when on the operating table and cause an infection. We advise that you should be brushing your teeth or dentures at least twice a day with fluoride toothpaste for at least 2 minutes, especially first thing in the morning and before bedtime. Using an antibacterial mouthwash at least once, but ideally twice a day, will also help remove bacteria from the back of the throat. However, it is best to use the mouthwash at a different time so you don't wash any of the fluoride toothpaste left on your teeth.
Hi, I'm Dave, I'm a physiotherapist. Undergoing a general anaesthetic can cause the tiny air sacs within the lungs to collapse. Deep breathing exercises both before and after your surgery will help you to reinflate these areas and prevent complications after your surgery. In order to perform the breathing exercises, firstly sit upright, as the lungs will expand better in this position. Place your hands on your tummy and breathe in deeply through your nose, pushing your tummy out into your hands as you do so. Try to hold your breath at the top for a count of 3 seconds, then slowly breathe out through your mouth. Repeat this for a maximum of 5 times at once, as any more than this may cause dizziness or make you lightheaded. Aim to perform these exercises 3 to 4 times a day at home in preparation for your surgery. This will help to improve your lung function and avoid chest complications after surgery. It can be quite common after surgery to get a build-up of mucus on your chest. It is important that you're able to cough effectively to clear this mucus in order to prevent a chest infection. Good pain control is essential so that you're able to take a deep breath and cough properly. You will be given a towel or a pillow to use to support your stomach muscles to help reduce pain levels when coughing. Huffing is a technique that can also help to move mucus when coughing is difficult or uncomfortable. It helps to move mucus up your airways so it's easier to clear. To do this, take a deep breath in and with an open mouth, breathe out forcefully as if you were trying to steam up a mirror. Sitting in a more upright position will help your lung function, increase the effectiveness of your breathing exercises and can help prevent a chest infection. If you do return to bed in the daytime, please do so for short periods and always aim to keep the head of the bed elevated between 30 to 45 degrees rather than lying flat, as this will give your lungs more room to expand and make your breathing easier. Getting out of bed after your operation is one of the key elements of your recovery. Getting up and moving as soon as possible will help to reduce the risk of a chest infection, improve circulation and can also help to decrease stress. Mobility also helps your bowel function to recover faster, stimulating the normal gut function, improving your appetite and your overall strength. If you are able to, and well enough, the nursing staff will aim to first help you sit out of bed 6 hours after your surgery. It can be a scary prospect, but as a team we will be there to keep you safe and guide you through it. In the following days you should aim to sit out of bed for a minimum of 6 hours per day, which can be in one go or broken up into smaller time periods. You should also aim to walk approximately 60 metres, which is the length of the ward, at least 4 times a day. In the initial period, you will be assisted to walk by nursing or physiotherapy staff to build up your confidence and enable you to walk regularly until you are able to do so on your own. Engaging in mobilisation, particularly in hospital, but also when you're at home, is the single most important thing that you as a patient can do towards a successful and speedy recovery from major bowel surgery.
We expect your recovery to progress well following your discharge, but occasionally complications may occur following major surgery. We try to pick up any problems as soon as possible by phoning you after your discharge. Depending on your reason for surgery, you will either be contacted by one of the enhanced recovery nurses or by one of the colorectal team. This will be discussed with you prior to your discharge. It is normal for you to feel tired when you first get home from hospital. Don't feel disheartened. This is natural after spending time in a hospital setting and getting home where you naturally relax more. Whilst at home, it is important to carry on with your recovery as you did when you were in hospital. This includes getting up, washed and dressed in the morning, sitting up in a chair for most of the day and ensuring you go for regular walks. Start by walking around the house. You can then progress to going outside into the garden or surrounding areas when you are feeling strong enough. This will further benefit your recovery and build strength and stamina into your muscles. This can also help reduce stress and anxiety. The first time you go for a walk outside, go with somebody and remember, don't go too far. You need to walk back from wherever you walk to, so don't make it too difficult for yourself. The important thing is remembering to do that little bit more every day. This will build up your stamina, help strengthen your muscles and improve blood flow to your wound and aid the healing process. You may feel tired at times. Again, this is normal as you burn more calories recovering from surgery. Try going for a lie down in the afternoon, then get back up again later. If you are worried about your progression at home or feel that you require assistance, you can contact a member of the enhanced recovery team via the number on the screen. We hope you found the previous school informative. What I now suggest is looking over the following slides in your own time at your leisure with a cup of tea and with a loved one if necessary. Each slide will be up for 5 seconds, but feel free to pause in between.